Well, definitely you have angles now.
Sabi niya, may
Pag yung angles mo. Okay, we're getting there. What was your big story? Yeah, but not much better. What are your big stories today?
Si Carl Chua, di ba, umiiyak na. Mukhang mag-ECQ na naman eh. Sabi niya, hindi naman matitigil yung spread ng COVID kapag nag-ECQ pa tayo further. Well, he's an economist, syempre. Yun ang tingin niya. Ikaw, Robbie, what do you think? Mukhang matutuloy.
Mahirap talaga. I mean, this is what we're gonna talk about again, di ba? Pero it's another piece of news that is on people's minds. I'm sure you saw it social media. Former President Joseph Estrada, akala natin he was in the clear already, but getting word from JV Ejercito na mukhang lumala ulit yung kondisyon ni former President Joseph Estrada.
Na-intubate siya, na-intubate.
He's now on a mechanical ventilator. There's Lucy Cruz Valdez, the head of news.
Hi, yeah. Yes, I heard about Erap na is in the news. Yeah, ICU na siya. Tapos lumala pa, no? Yeah.
Malakas naman yung fighter naman yun eh. Malakas ang katawan nun.
Yeah. And did you see that story about, ewan ko kung napag-usapan nyo na, yung kotse na nilagyan na lang ng oxygen at saka nakinabitan na lang doon sa labas sa parking lot ng oxygen tank tsaka kape. Parang ito na lang. Yeah, bilib ka rin sa resourcefulness ng doktor.
Mukhang okay na yung pasyente. Nag-stabilize yung pasyente.
Yes. Actually, hupusay siya. So, she saved a life there.
Apparently, kailangan ng pasyente at that time was oxygen. Mababa yung blood oxygen niya.
So, but to be in your car, di ba? At no time.
Saka nandun na yata siya hanggang eh. Paano yun?
Well, hindi ko alam, pero matagal din eh. Tagal din yan.
Yeah. Well, the good thing about that then, Lucy, is that the patient was in the car, so it's air conditioned. Kasi we did see some material before last week lang. For example, last week sa Santa Ana Hospital, nasa tents, naka-oxygen yung mga pasyente. Ang init talaga.
Hanggang ngayon.
I mean, I'm sure this is not necessarily what he was talking about, di ba? Pero yung sinabi nga kahapon ni Dr. Almora, will take any out-of-the-box thinking that increases capacity. This does not necessarily increase capacity, but it does show the dire situation sa mga hospital natin ngayon.
Sige. Tanungin na siguro natin yung guest natin.
Okay. The segue is there.
Let's get into that.
Okay, let's bring in our first guest for tonight. It's Health Undersecretary Maria Rosario Vergere. Yusek Vergere, maraming salamat po for joining us tonight and welcome back to the Chiefs.
Magandang gabi po sa
inyo, sir.
Good evening
po.
Yes, ma'am. Ma'am, kahapon po kasi you did say na around 41% by the DOH's own survey, yung mild or asymptomatic doon sa mga hospital, and I think you even used the word extract. The government have to take out or extract these people from the hospitals to make room for those who are more in need, and I think that's understandable. That's part of the PH system. My question po is, how do you intend to do this? You're talking about around 2,000 out of, I suppose, more than 2,000 out of the 6,000 odd beds in Metro Manila devoted for isolation and for COVID wards. Mga 4 out of 10. Malaki-laki po yun. And how do you intend to do this?
Yes, sir. No. So again, good evening to all of you. Yes, sir. We have this program, which is the step-down care program, and it has been implemented since last year. It's part of our protocols, and our hospitals know about this. So ang kailangan lang po, we need to have an enabling environment so that we will be able to do this. So yesterday, we met with our regional office together with the One Hospital Command, MMDA, DILG, and we were able to identify immediately isolation facilities beds where we can be able to transfer and do this step-down care program. We were able to identify identify 3 hotels which MMDA and the Oplan Kalinga was able to negotiate with. And we also were able to identify big isolation facilities in the local government units where we can at least have at least 100 to 200 beds. Aside from that, we were able to do the census of our level 1 hospitals and infirmaries, which are not really being used for COVID as of this time. And in our protocol, they are the hospitals or the facilities that we can do step-down care program. So all of this, we are trying to match with the demand. And as I have said this morning in my interviews, we have around 41% of those admitted who are mild and asymptomatic. But we have to qualify this because most of those who are admitted who are mild also have comorbidities or are elderlies. So these patients, we cannot transfer all at once to this step-down care. We still need to monitor them in a hospital setting, such as our tertiary hospitals. So we will be prioritizing who we can transfer. I'm sorry for the word, it is not really extract, but it's really stepping down the care so that we can further decongest our hospitals and then we can manage more those who are really in need of hospital services.
Pero paano po yun?
Is this going to be a compulsory program? Saka paano yung mga bagong patients? Kasi if you're going to transfer na yung mga dati, kung halimbawa may mag-walk-in na mild na symptomatic, hindi na rin sila tatanggapin ng hospital. They will be referred na lang to the isolation center. Ganun ba yung program na yan?
Yes, ma'am. Actually, even before our instructions and this kind of plan that we have instituted yesterday, our hospitals have slowly tried to decongest their hospitals already. Like their healthcare workers were transferred to hotels already, and those that they can deem or assess to had been able to recover already and can be discharged, they have discharged already. And some were transferred already to their step-down care facilities. We are just going to continue it and make it more intensive. Now, for those people now admitted in our hospitals, the medical center chiefs will be explaining to them the step-down care. We need to have enabling environment. We need to have this kind of environment where when we transfer them, they would also be comfortable and they would also be assured that they will be monitored by medical professionals. So that is what we are trying to set up right now. And one of the things that I want to emphasize, there are 2 types of patients right now. The first type would be those patients who are still set to go to the hospital and in need of the hospital but are still not in the hospital. And the second would those patients who are already in the hospital but are mild and asymptomatic. So these are 2 groups of patients that we need to give solution to. So the first one, what we have done, we have discussed with our Metro Manila mayors and the Metro Manila Development Authority and the ILG. We will be setting up LGU triage systems. Actually, it's already in place. We just need to make it more comprehensive and we have to link it with the one hospital command. So they have set up their triage system where we break the chain that individuals are now flocking the hospitals because they do not know what to do. They are not guided. They are not navigated into our system. So with this LGU triage system, we will break the chain where people go straight to the hospital. They go through the triage system, and this triage system in the LGUs will navigate patients to the appropriate facility, whether it be a quarantine facility or they really need a hospital. Aside from that, it has to be equipped with a patient transport vehicle so that patients will be transported all at once to these appropriate facilities comes the need, no? Kapag nandun na po sila. And we have linked our telemedicine services to our local governments so that those people in the houses and they need somebody to talk to for guidance on what they should do if they are feeling symptoms, they can talk to specialists in these telemedicine platforms that we have, and this is all for free.
Okay. Ma'am, yesterday, si Dr. Almora was talking about capacity versus capability, no? And he was saying, in effect, na there may be more beds available and there will well be more beds available probably the days to come, especially with your triage system. But the question is, who will take care of them in these other facilities, whether it's the hotel, if you're going to bring some of them there, or the quarantine facilities, if they are mild or, mildly symptomatic. Paano po yung care considering that ang problema nga po ngayon ay kulang sa health workers?
Yes, ma'am. No? So we are very much aware of these different components of having a functional hospital bed. No? So kailangan po natin ng bed, of course. Marami tayong kama talaga. Pero yung ibang components, dun po tayo nagkukulang at medyo challenge po talaga yan sa atin ngayon because we can see that our healthcare workers are getting infected. And also, marami rin pong nagre-resign, nagre-retire out of fear and frustration. So ngayon po ang ginagawa natin so that we can be able to have these functional beds para po dun sa mga quarantine facilities, we have already deployed additional healthcare workers and also the uniformed personnel are helping already. The military reservists had been deployed to our mega facilities so that they can help in monitoring our patients. Now for the healthcare workers in the hospitals, we are now seeking the help of other regional areas where there are low cases of COVID so that they can immediately deploy extra healthcare workers to the national capital region. But we know this is not really sustainable. This is something of a short term. We have this emergency hiring program where we are tapping the healthcare professionals and encouraging them to sign up because we have benefits provided to them. We will incentivize so that we can beef up our cadre. So ito po yung mga tinitingnan natin sa ngayon na immediate measures that we have to do so that we can already replenish the healthcare workers in our hospital.
Ma'am, kagaya nga po ng sabi niyo, you don't necessarily think this is going to be sustainable. Could you give us an idea of yung uptake naman dito sa imbitasyon pati sa pag-incentivize? And what are those incentives?
Actually, sir, ito pong emergency hiring natin has been there since last year when there was this initial increase in the number of cases. So we have this target of about 12,000 that we can be able to hire so that we can deploy in the different health facilities, not just in hospitals, in laboratories, and in other facilities that we use for the response. Unfortunately, through all these months, we only have until now about 7,000 plus that we have hired. And there are still available items for about less than 5,000 that we can still hire. But the uptake really is a challenge. That's why we are doing it now purposively, where we are coordinating with the different organizations of healthcare professionals so that they can heed the call to help government at this time that we really need it.
Merong proposal na kumuha na lang daw temporarily habang ganitong nagsa-surge, kumuha daw sa mga low-risk areas ng mga health personnel. Is that a viable proposal?
Yes, ma'am, we already did that, and we were able to have about 46 healthcare workers from the different regional areas who are going to be flown here to Manila within this week so that they can help our hospitals. But we know that is not enough. So we are still having this call to all of the healthcare professionals who would want to help government at this time.
Ma'am, can you elaborate on this, yung co-pay system ng PhilHealth, which according to Dr. Almora is the one that's keeping small private hospitals from admitting patients. Kasi raw pagka bawal raw sila mag-co-pay under this PhilHealth circular. Totoo mo ba yun? At hindi ho ba pwedeng isang tabi muna yon for now na may kakulangan nga po?
Well, ma'am, actually, it is really PhilHealth who has the authority to explain and give the response to this. But if I may just give a brief concept of what this is all about. When we had the different case rates of PhilHealth, this was computed based on a bundled package of services. Meaning, if I tell you that the case rate, for example, for pneumonia is 15,000, in this 15,000, all of the services that you will offer to a patient in order for you to to treat them is already there, including the professional fee. So when you say it's copay, it's payment on top of PhilHealth. In the
Right.
ideal setting, based on the universal healthcare law, there should be no balance bill for the patient if PhilHealth is paying already. So that is the concept. So now PhilHealth issues this circular, and maybe they are just reiterating the call that in these times of this kind of situation where our citizens are having a hard time with this COVID situation, going to the hospital and financing it, they are calling for this no co-payment so that the individuals or our citizens won't have this financial hardship because of getting hospitalized and all when PhilHealth is already paying our hospitals.
Pero
Yusek,
for
medyo,
Pero
him,
ma'am, sinasabi po ni Dr.
that
Almora was
if you
that
don't
mababa raw po
know,
yung benefit package. Mababa raw po kasi
right,
yung benefit package ng PhilHealth for COVID-19. So, dahil mababa yung
malulugi
benefit
sila.
package, kailangan mag-out of pocket at bawal naman yun dun sa Circular 009. So, therefore, it is passed on to the hospital. In other words po, ang sasabi po ni Dr. Almora kahapon, private hospitals, some of them have to turn away COVID patients even though they have the beds because malulugi
Yes.
raw sila.
Well, as I've said, it's PhilHealth which should be able to address this kind of issue. Although sana po, nakikiusap din naman po ako sa mga private hospitals. I know that you are business enterprises. But at this time of need for our citizens, sana po nako-consider din natin yung pangangailangan ng ating mga kababayan.
Yusek, medyo ba iba po because talagang, I mean, much as some people don't want to talk about this, it's really a hot topic, ivermectin. Meron po bang bagong guidance? What is the latest on ivermectin? Where does the DOH stand on this right now? And for that matter, where does the DOH stand on Congressman Defensor offering to hand out ivermectin for free?
Yes, sir. Actually, nakapagbigay naman tayo ng posisyon na the Food and Drug Administration already issued their advisory this morning kung saan sinasabi nga po natin at binabalaan natin ng ating mga kababayan na wag ho kayong magtatangkilik ng mga gamot na hindi po rehistrado ng Food and Drug Administration because it might cause you more harm than good. We cannot assure the safety and the quality of these medications if it did not pass through a regulatory process. Pangalawa po, hindi pa ho nakakapagbigay ng positive recommendations ang DOH nor adopt this in our guidelines para dito sa gamot na ito. Dahil yung pong mga experts natin and even WHO specifically said that ivermectin should only be used in a clinical trial setting at this time. Because we are still trying to find more evidence that it is really going to give us protection against COVID-19. So up until that time that we get more evidence and the evidence will show that it can really protect us from COVID-19 or it can lessen the severity of COVID-19 for individuals, that's the time that DOH will give these guidelines and adopt ivermectin as part of the COVID-19 treatment. Hindi po sarado ang pintuan ng Department of Health para sa mga ganitong investigational drugs. Gustong-gusto ho namin na magkaroon na tayo lahat ng gamot para sa COVID-19. But we have to do it in a scientific process. We have to base it on evidence and science because we are mandated to protect public health.
Yusek, balikan ko lang yung hospitalization problem. Kasi sabi ng mga doktor, kung maaari daw tayo, mga tao, kung makaramdam tayo ng, or we suspect, kahit asymptomatic, kung mild lang we suspect na meron tayong COVID, kung maaari daw, hanggat maaari, sa bahay lang muna tayo. How will we know kung dapat kami magbahay o we have to go to the hospital na?
Tama po yan, ma'am. Kaya nga po for this past date, we had been issuing these FAQs through our social media platforms kung ano ang dapat gawin ng ating mga kababayan kapag sila ay nasa bahay at nakakaranas ng simptomas. Alam niyo po kung ano ang nangyari sa atin, kung bakit ang bilis na puno ng ating mga ospital. Tayo po ay siguro ang ating mga kababayan ay nagkaroon nitong mga pagkatakot. They have this panic, they have this fear, and basically Filipinos po kapag po tayo ay may nararamdaman, ang una nating napupuntahan talaga ay mga ospital. No, dahil mas gusto natin na sigurado yung magiging management na sa atin. And this is what happened. That's why we saw talaga 41% really mild and asymptomatic cases. So now, as I've said, we are breaking that chain by having the LGUs monitor and triage the patients para hindi dire-diretso sa ospital. Pangalawa, yung telemedicine natin, ini-intensify natin para they can call this specialist para i-guide sila kung ano ang dapat gawin. And pangatlo, meron ho tayong mga pinalalabas na impormasyon kung ano ang dapat nyong gawin sa bahay at kung kailan kayo dapat talagang magpunta na sa ospital.
So, kailan kaya
Isa pa pong sorry.
At what
Yeah,
point
isa pa
kaya yun? Kailan yan?
Yeah, the suggestion din of Dr. Almora from last night's interview was to increase the number of testing by making it really more accessible to anybody who can afford to buy test kits on their own. In short, to make it commercially available so that people will know kusa nila, na sila mismo magdi-DIY test para malaman nila kung positive sila, and then they'll just stay put wherever they are. What do you think of this suggestion?
I don't think that's very rational. Unang-una po, hindi tayo nag-advocate ng mga ganyang sistema, no? It's just like mass testing, no? Everybody. Pangalawa, hindi pa rin ho natin pinapayagan na mag-test ang mga kababayan natin sa bahay. Ito pong mga test na meron tayo ngayon, even the rapid antigen test, kailangan po nag-a-administer niyan ay isang healthcare professional. Dahil po yung interpretation din niyan, dapat healthcare professional ang nag-i-interpret. Ang atin pong mga tanggap na mga methods ngayon for testing would be the RT-PCR, of course, the gold standard. And ngayon, pinapagamit na ho natin ng rapid antigen test dahil nga po may increased community transmission at yung sensitivity po ng test na ito tumataas kapag marami po ang mga kaso. But this rapid antigen test would still be administered by our healthcare professionals in the communities through the code strategy. So ito pong mga pagtaas ng pagtetest, ayon po yan, ako po ay sumasang-ayon kay Dr. Almora. Isa po yan sa strategies na ginagawa natin ngayon. Kaya nga po pinayagan na natin ng rapid antigen test para pag nagbahay-bahay na ang ating mga local health officials sa communities, magra-rapid antigen test, within 2 to 4 hours we can get the result and we can already isolate the patient all at once. So mapuputol po natin yung transmission ng sakit.
But not DIY. Okay.
Okay. Ma'am, I'd like to go back to dun sa the plan to depopulate yung hospitals. Would you have any estimate? Would you have any estimate kung ilang daan or ilang libong beds ang maaring ma-free up and anong timetable? Kasi earlier you said nga 41%, pero siyempre may qualifier yun na yung mga may comorbidities hindi kasama dapat eh. So any estimates on how much and by when we can start seeing some progress?
Well, when we had our meeting yesterday, we wanted that by tomorrow we start already. Kaya nga po nung kahapon, nag-iimbentaryo kami. Kahapon meron na kaming na-identify na almost 400 beds na pwede nang gamitin agad-agad na na-negotiate na natin. Ngayon po, nagmi-meeting, hindi pa rin tapos yung ating mga ospital naman with our One Hospital Command at pinaplano na kung anong gagawin natin. And with that meeting, lumabas na ginagawa na pala ng ating mga ospital slowly na nagdi-decongest sila by ito na nga pong inaalok ng ating mga gobyerno na para dun sa kanilang healthcare workers para hindi na maka-occupy ng mga spaces sa ospital. Yung ibang mild at asymptomatic, dinicharge nila, transfer sa ating temporary treatment and monitoring facility. So we will just continue and intensify this para meron naman po tayo kahit gradual hanggang dumating maybe ang Friday, makapagbawas tayo kahit sabihin natin 1/4 of this 41% we can remove, then we can accommodate more of these patients who really need the hospital services.
Mm-hmm.
Yung sa kung tumanggi yung pasyente. Paano kung tumanggi yung pasyente?
Oo, paano yun? Is it mandatory?
Paano kung ayaw niyang malipat?
Actually, ma'am, sa tingin ko, yung pagtanggi, hindi naman po. Kasi pipiliin na mamaigi ang mga pasyente. Yan na po yung mga pagaling na, yan naman po yung mga wala nang nararamdaman, tapos ililipat naman sila sa isang comfortable na place. I think they will also agree. So, hindi naman po yung talagang may nararamdaman pa, ipinipilit na natin lumabas. So kaya nga sabi ko kanina, I apologize for using the word extract. We are not really going to extract, no? Parang napaka-insensitive na word. We are really going to implement the step-down care program.
Ma'am, how does it
Mhm.
look now that the Okta research has said that the R naught has gone down to 1.5, I think? Does it look like we're going to be extending the ECQ?
Actually, ma'am, we don't really use the R naught or the transmission rate para maging basihan para dito sa ating mga community quarantine classifications. Because the R naught or the transmission rate is affected by so many factors. Although, of course, it's part of our analysis, pero hindi talaga siya yung sole basis natin. And one has to be very careful when we interpret the R naught. It might be going down right now, but there are a lot of factors which affects the decline, no? Unang-una na po, nung nag-Holy Week po, marami po mga laboratorio ang hindi nagbukas. So with that, nakita niyo po kahapon at saka ngayon, hindi po pumapalo ng 10,000 mahigit ang ating mga kaso. Ngunit this is artificial. So kailangan po yung interpretasyon natin ay maitama natin na alam kasi natin ang may mga laboratories na nagsasubmit na nakakaapekto dito sa current numbers natin. So ito pong pag-extend ng ECQ, pag-uusapan po yan ng IATF base sa mga parameters na atin pong ginagamit. And first, among all of these parameters, of course, will be our healthcare system capacity.
Okay. Okay, Undersecretary Maria Rosario Vergere. Ma'am, maraming salamat po for joining us tonight. Datingan po.
Thank
Salamat
you,
po.
Sec.
Maraming salamat po.
We will just go into a break, so please stay with us.
Welcome back, the Chiefs. We're still with our co-anchors here, Lucy Cruz Valdez of News 5. I'm Kamituan of the Philippine Star, and One News, Ed Lingao. While we're still waiting for our next guest to come on, we're still going to talk about PhilHealth and the situation in the hospitals. But I just wanted to say, for the past 3 days, we've been talking about the dire situation in our hospitals. But I have to say this in all sincerity, every time I talk or we talk to you, Sec Vergere, parang kumakalma ka. Di ba? She's always kept the same tone. Di ba?
So
And at the same time,
unflappable. No? That's
Unflappable.
how she looks to me. Parang, grabe to, hindi talaga nagpapanik, no? Hindi nagre-react. Very even. Yung kanyang, yung emotions niya. Ang galing ng composure.
She reminds me of my math teacher.
But I have to say also, at the same time, she gives you all the facts at her disposal. Diba? You ask a question, she gives everything. I really just wanted to give a shout out to Yusek Vergere. And yun nga po, if you listen to her tone from the start of last year hanggang ngayon, you can never tell kung kailan niya sinabi to. Dahil talagang steady lang parate. But you will get what you want in terms of information.
Yeah, you won't.
Just like the math teacher.
No, in TV lingo, you won't get the opening soundbite. Panggol pinigulan. Kasi di ba ganon kami lagi? We open with a really strong soundbite. Yung talaga. Well, ito, kalmado siya. Siya yung tipong dun siya sa Denoma. Sa resolution siya. Okay, this is what the government has to say.
Yung kahit sabihin niya nga, the world is ending right now, parang, okay.
No, but I do say that. Also to say,
ganun siya. No? Parang meron pa rin siyang sagot doon. We
sabihin
already know that the world is... we already know this, and we are prepared for the world to end. Parang ganun.
But in all seriousness, I wanted to say that because, for the past days, we've been trying to get a real sense of what's happening in the hospitals. And we're swinging, well, not naman to extremes, because nobody's saying it's ideal. Everybody is saying there's a problem. But the extreme to which we've swung is really hospital administrators and hospital authorities saying yesterday their word was, it's a nightmare. It's a disaster. This is the worst we were anticipating.
Parang palengke. Parang palengke. Ganon, eh.
Diba? And it's hard to reconcile, diba? When you listen to the numbers, kahapon, Bok, you were making that point, diba? When you listen to the numbers, it still takes time doing to reconcile what the numbers are suggesting and what doctors are saying on the ground.
Well, sana nga matanong nga natin yung mga, pagdating ng PhilHealth, tanong natin yung problema sa hospitals. Kasi mukha namang may lugar pa nga sa hospitals, di ba? Ngayon, yung
parang
mga...
depende. Parang depende.
Depende sa hospital.
Some hospitals na punong-puno na talaga. I mean, the video does not lie, no? Kitang-kita mo naman talaga, punong-puno. Pero yun nga. Yeah,
but the numbers do look like they're misleading. Kasi you look at the numbers, they give you a different story altogether from what's happening on the ground. I'll give you the numbers today. The numbers today, ICU beds, 82% lang ang used. Isolation beds, 71% lang ang used. Ward beds, 60% lang ang used. So ward beds, may 40% pa. 29% pa ang isolation beds na pwede at 18% pa ang pwedeng ICU. If you look at the numbers, they tell a different story altogether.
Pero yan yung sinasabi ni Dr. Almora yesterday, which Lucci brought up kanina, di ba? He made the distinction between capacity and capability. And I don't know if capability itself is a technical term. I don't know if it's a measurable index. But he made the point na kung capacity, bilangan lang literally ng bed space, you can probably try to justify it that way. But when you factor in resources, when you factor in what level of hospital is this, when you factor in human resource and the fact that there are no nurses and we have to call in doctors from other regions, ibang usapan yon. So the big question is, what's the gap between capability and capacity?
Pati yung government hospital, sabi nila may space pa naman daw. Except for sa some of lung center puno na, no?
Or let's put it this way.
And KTI, sa Taana, sa Lazaro. Actually, ang daming puno. Hindi ko
sila. Kaya medyo magulo. Tingnan natin, bukas uumpisahan yung hospital stepping down, no? Stepping down. Bukas uumpisahan. Tingnan natin kung anong mangyari. Saka tingnan natin
kung anong... Tama ka, Lucci, di ba? Parang if you look at not just on social media, even the people that we know, I'm sure all of us know somebody now who's gone through that that cavalry of
Yes.
looking for a hospital.
Just somebody.
And it's
a
not for
number
lack of
people.
it's not for lack of resources to seek it out, because I know people na hanggang Batangas naghahanap na sila ng ospital and talagang wala eh. Parang you have to trust them when they say that
Oh, yeah.
sinubukan namin maghanap, and yesterday kagaya nga ni sinabi ni Dr. Limpin, 'di ba? It takes 3 to 4 days once you're at the doorstep of the hospital to actually get a space inside the hospital.
Pero
But that's only part of the
yung
story,
iba
Buka.
doon,
The other part of the story pa rin is what he was saying kahapon si Dr. Almera na quite simply tumatanggi yung ibang ospital because they can't afford it.
So hindi
Diba?
dahil sa walang space, kundi they don't wanna make space. So yun ang tanong doon kung ilan
So one is yung the capability to accommodate patients with
and the
medical care,
willingness.
and the capability of the hospital to finance
The willingness
the care. So those are
Kaya
two different things eh.
Kaya siguro maano ng mga tao dahil sobra-sobra kalat ngayon ng COVID eh. Siguro tingnan natin kung mag-work yung telemedicine ng DOH na mag-a-advise mga tao if you just stay home para hindi ka na mag-dumi, no? Tingnan natin.
Or mag-Ivermectin na lang.
Oo nga. Ayan na.
Magalit si
Don't go there.
Magalit si Robin yan.
Don't go there. No, really, I am. I think it's really, hirap na yung mga doctors natin trying to communicate to people, trying to bring up the level of confidence in vaccines. I really think it's a terrible thing that it's complicated, the things. I mean, just the fact that may problema tayo sa hospitals, wala pa yung vaccines, wala pa yung ayuda. And on top of all of that, we have to talk about ivermectin. I mean, I have a lot of doctor friends who are really saying, parang pwede ba? Parang can we just focus on the things we need right now?
Yan na lang ako, Lianghaw. Hindi ko alam ang spelling.
Isa pa yan.
Ano na naman yan?
Nandiyan na yung guest natin. Ipasok na natin.
Nandiyan na ba siya?
Nandiyan na guest natin.
Okay. Okay.
Yeah.
Okay, finally, joining us for our conversation, PhilHealth spokesman Ray Balenya. Good evening, Mr. Balenya.
Good evening.
Good evening, sir.
Sir, can you hear us?
There you go.
Nakamute po yata.
Nakamute.
Hi, I'm so sorry po. Magandang gabi po sa inyo. And thank you po for having us in your program po.
Mr. Balenya, we started, actually kanina pa sa big story, umpisa na natin yung kwentuhan tungkol sa ditong this co-payment scheme. And at bottom, what Dr. Almora and the Philippine Health Association Hospital Association was saying yesterday pa is, sabi niya nga, we're caught between, it's a real dilemma. On the one hand, syempre ayaw naman naming magpaalis ng mga tao. We want to accept people as they come. On the other hand, he's saying, pagka naman tinanggap namin, ipit kami dito when it comes to the co-payment scheme kasi we're restricted basically, if I understand it correctly, we're restricted on what we can finance and also what we can co-finance and what we can collect from the patients. And now we know there are conversations with PhilHealth already between the PHA and PhilHealth, but let's start with the basic para maintindihan po natin. Ano po ba ang pwedeng i-cover ng PhilHealth when it comes to COVID cases, whether from mild all the way to severe cases?
Well, meron po tayong existing na COVID-19 packages. So ito po ay kapag kinailangan na ng pasyente na sila ay ma-hospitalize for full treatment. So for those who are experiencing mild pneumonia, especially in the elderly or with comorbidities, ang ating pakete po dyan ay 43,997. Now, sabi ko nga kanina din sa interview with you, Roby, so depende yan doon sa severity nung pneumonia ng pasyente. So starting with mild pneumonia, that's 43,997. Kung moderate pneumonia naman ay 143,267. Now, if the patient has severe pneumonia, ang package natin dyan ay 333,519. And for those with critical pneumonia naman ay hanggang 786,384. So tama po kayo dyan, no? And we appreciate the concern of the Philippine Hospital Association for bringing this up yesterday during our dialogue with them. And Atty. Giran committed naman that PhilHealth will serious into their concerns patungkol po sa bagay na ito.
Yun po yung co-payment, yun yung binanggit sa amin ni Mr. Almora. I know you have a circular nung December pa, di ba? About the co-payment. So, hindi naman siya kasabay actually ng surge. Pero yun ang gusto nilang mawala ngayon kasi yung mga member daw nila, lalo yung maliliit, hindi daw tinatanggap ngayon yung ibang mga pasyente dahil nga dyan sa prohibition na yan. Is PhilHealth willing to change this policy? Circular yun ng PhilHealth eh.
Well, tama po kayo, Ma'am Ana. Pero kung sususuyin po natin yung issue po talaga ng co-payment as a privilege to PhilHealth members, galing po talaga yan sa Universal Healthcare Law. Ang sabi po sa Universal Healthcare Law ay talagang dapat kung ang pasyente ay malalagay, mako-confine sa basic or ward accommodation, dapat po wala talaga silang babayaran. At ang provision ng UHC dyan ay kahit nasa private facility pa po. No? So, yan naman po ay mandato, provision po ng UHC law. At tayo naman sa PhilHealth ay pinapatupad lang po natin yan. Now, kung issue ng co-payment insofar as COVID-19 packages are concerned, nanggaling pa yan early part ng 2020 nung inintroduce po natin yung ating policy over these packages. I am so sorry, lobat pala yung laptop ko, sasaksak ko lang po. Okay lang po ba?
Sige sir, basta you stay with us.
Sige lang po.
So, kayo,
Pag
Alex,
kami iwan.
I am asking my wife to have it plugged for me. I'm so sorry po. No?
no, it's okay. It will
Okay
not
lang po.
interrupt our discussion in any way. Go ahead po. Yeah, were you done?
Sir,
Sir,
are you,
Yeah.
bali, the numbers that you gave kanina, yung 43,000 for mild pneumonia, ito yung sagot ng PhilHealth, and anything above that, yun na yung copay, no? Tama ba? Ang intindi ko? Anything above 43,000 for mild is already copay. Everything above 143 for moderate pneumonia is already copay. Ito na po yung hindi dapat babayaran ng pasyente according to Circular 009.
Hindi, may flat rate yata yun sa copay. May flat rate na gusto
Oo, tama po kayo. Ayon sa policy, dapat wala na po talagang
Wala nang
wala po
babayaran.
talagang dapat.
Mm.
Opo. Oo, ayon sa policy ay talagang dapat wala nang babayaran.
Mhm.
So ano
pero
po
sir,
kaya
sabi po
yung...
niya, no?
Kasi nga po,
Ang sabi po kasi ni Dr. Almora, ang claim niya, mababa raw yung packages. So kung mababa raw yung packages at lumabis doon sa numbers na ito yung gastusin, babagsak sa ospital yung
Lugi
sasagot
sila.
nung balanse. Yun ang claim nila. I'm not saying that it's correct.
Yes.
I'm just saying that's what their claim is. Kaya raw nangingimi yung ibang ospital na tumanggap ng COVID patients. That is their
well,
claim.
alam nyo po, when we ang naging basis po ng costing ng ating packages ay galing din sa actual costing data na ginather natin from hospitals that are treating COVID-19 patients. And so we can very well say na talagang yung packages are kumbaga reflective, no, or sapat na siya, akma siya para doon sa complete management ng pneumonia ng pasyente ng COVID. So masasabi po natin na talagang tumutugon ito, no, sa pangangailangan. Ang atin pong pinag-uusapan dito is that for all direct healthcare costs, so these were all properly costed and accounted for last year. And so we were able to come out with these packages. Ngayon, ibang usapan po, kung halimbawa the patient availed of amenities, no, like he or she elected to stay in a suite, no,
Yes,
or
yes.
gusto nila aircon o walang kasama sa kwarto, may wifi,
Hindi na covered
then
yun.
it's a different story.
Definitely, yes. Okay.
Yes.
Opo.
Doc,
the
Ay,
patient
sir.
has to understand na talagang meron na silang babayaran. Opo. Yes, ma'am.
Sir, you just announced na na-liquidate nyo na yung 14.7 billion ng 15 billion na hindi mapanagot ng PhilHealth nitong nakaraang taon. Pakipaliwanag nyo nga po kung paano nyo na-liquidate yun. Saan nyo nakita yung gastos? Saan?
Well, Ma'am Lucy, yun po yung patuloy nating gusto na i-address at linawin sa mga kababayan natin. That the 15 billion was not stolen, it was not lost, hindi po yan missing. Yan po ay properly accounted for. That 14.97 billion to be exact po, last year were provided to hospitals and facilities around the country that applied for it. At may pinamahagi po sa kanila. At naglathala tayo ng listahan ng mga hospital, sino-sino sila, magkano yung nabigay po sa kanilang IRM, And over the course of this months, they were able to liquidate it. It's the hospitals that are liquidating it in the form of claims. In fact,
So
meron nga pong mga hospitals na
wala na kayong pinagkakautangang ospital na nag-file ng for IRM? Wala na? Bayad na lahat yun? Ganun po ba yun?
Well, insofar as the 15 billion is concerned, the hospitals are accounting it with us by way of liquidation. So, may mga hospitals na tapos na silang mag-liquidate because they were able to, file na the claims, na chinarge po nila doon sa kanilang IRM.
Yes.
May mga hospitals na counting-counting na lang na kino-complete na, kasi sabi nga natin, hindi rin lahat ng hospitals ay nagamit agad-agad po yung IRM because of the decrease in patient admissions, patient census. And there are some hospitals too that returned part of their IRM dahil talagang hindi naman nila maliliquidate na. Ibig sabihin, hindi na nila magagastos. So these are all properly accounted for. At the moment, it's 98% po, 14.7 billion. So we are down to the last 200 million at nag-issue na po ng direktiba si Attorney Giran sa mga hospitals na madaliin po yung liquidation.
In the
So
meantime,
tuloy po pa ulit yun? Kasi pinang-halt yun, di ba? Hindi po ba pinatigil nyo yun? So tuloy po ba na ngayon yun?
Hindi po. Until now, hindi na po siya itinuloy since the time that it was suspended middle of last year.
Okay, so go ahead,
Sige.
Tommy.
In the meantime, nag-pile up na naman yung utang nyo sa Red Cross, over 870 million na naman. Bakit ganon? Kasi ang laki-laki ng role ng Red Cross, lalo na sa testing, kulang na kulang tayo eh. Nahihirapan daw sila kapag ganyang kulang yung dumadating sa kanilang bayad. Bakit ganun kabagal yung pagbabayad sa kanila?
Well, una po, naiintindihan po natin yung situation din ng Red Cross. We fully understand their predicament dahil just like any other business po, actually liquidity is really key. Pero alam nyo po, sa bahagi naman ng PhilHealth, ang patuloy po nating gustong linawin po dyan, ang amin pong duty talaga is to reimburse only claims that are fit for payment. So yung good claims. So actually ang atin pong katungkulan is that we pay if these claims are compliant to existing rules and policies, and especially those of the Commission on Audit. So that is our commitment, especially to the people, because the money that we are using to pay the Red Cross and other accredited healthcare providers come from our members, and that includes you. So yun naman po, doon naman po kami nanggagaling. Alam nyo po, hindi naman lahat ng claims agad-agad pwedeng bayaran. Kahit kayo, magagalit po kayo sa amin. Kung kami bayad lang ng bayad, hindi po natin inaayos yung processing. As of today, ang atin pong naibayad na sa Red Cross ay 4.5 billion na po. At we have returned some claims amounting to some 270 million At ito ay kailangan po talagang ibalik sapagkat mga deficient po ito, may mga kailangan pong itama. So ang amin na lang panawagan naman sa Red Cross ay maibalik din po agad sa amin so that we can process din naman these claims. Alam niyo po, sa ngayon,
Anong deficiencies yun? Kasi nag-utos ngayon si Presidente na i-cover daw ng PhilHealth yung RT-PCR ng Red Cross, saka pati nga yung tent stay, nag-utos sila, in-expand yung coverage pa eh. Kaya ba yun ng PhilHealth?
ay opo. Actually, lagi tayong nakahanda sa ganyang mga panawagan. And in fact po, ang masasabi natin na basta lahat ng mga kababayan natin, basta sila ay at risk, no? Sila ay may pangangailangang matest. Sila po ay nandun sa mga at-risk groups as identified by the DOH. Lahat po sila ay entitled sa PhilHealth benefit for RT-PCR. So yan po ang katotohanan dyan. So nananagot tayo at yan ang bahagi natin sa COVID response, sa laban na ito ng COVID.
Mr. Balenya, ulitin ko lang po kung tama po yung sinabi nyo nga po, no? Kaya pa na ng PhilHealth, you're reassuring people. But I also want to take time na kumustahin din ng PhilHealth. We've been talking about payments, we've been talking about coverages. On the other side of it, what about collections? What about contributions? Marami pong nawalan ng trabaho, the economy is going down. How is all of this affecting the fiscal health of PhilHealth? At kaya pa ba talaga?
Well, definitely may effect po, no? Sapagkat hindi lang kakaunti, milyon ang pinag-uusapan po natin ng mga members po, no, na tumitigil, nawawalan ng trabaho at hindi nakakabayad. But on the good side, ay marami rin po mga membrong tuloy-tuloy pong nagbabayad. Actually, ang mga clamor nga sa amin, nasaan yung online payment module kasi ayaw namin lumabas, and yet we want to settle our PhilHealth contribution. That's why recently we launched our online payment facility. Sa bahay lang, sa opisina o kahit nasaan, pwede nang magbayad. Now, what we are saying here po is that despite the situation, despite alam niyo naman po deferred yung dapat ay umento sa premium contribution ngayong taon. Pero ang atin namang PhilHealth ay namamalagi po na matatag, and ang ating reserbang pondo nandyan lagi po at nakahanda para sa anumang eventuality. So yun po ang ating garansya sa mga members na ang programa nandito, matatag, hindi ho matitigil yung kanilang benepisyo.
Sir,
Ray,
klaruhin ko lang po, may mga report na hindi nyo raw kino-cover yung mga yung ina-admit lang sa tent, hindi makapasok pa sa ER, pero nasa tent in some isolation facilities. Is it true that you don't cover them? And in fact, in some areas, in some facilities, they're made to pay 1,000 each. How true is that?
Well, we have yet to look into the alleged 1,000. So, but we thank Congressman Guyton for raising this. Ang totoo po niyan, nag-utos na po si Attorney Giran na imbestigahan po ang bagay na ito. At hindi lang po yung ospital na involved dun sa insidente, kundi baka may iba pang mga ospital na ganito rin ang practice. Sa ngayon, wala pa ho kaming masasabi doon sa investigation. Kaya nga nanawagan po kami sa mga kababayan natin doon sa mga may alam pa, may impormasyon pa, at may nalalaman pa tungkol sa ganitong practices. Sana po mag-forward sa amin ng impormasyon, makipag-cooperate so that makatulong sa investigation at ma-actionan po yung dapat pong maparusahan kung may nalabag po sila sa batas. Now, going back to the 10th issue, nilinaw din po naman agad natin yan. Ang sinasabi natin ay kahit na yung pasyente nasa tolda o kahit nasaan man siya, basta po siya ay tumatanggap na ng mga serbisyo, inaasikaso na po siya, ginagamot na po siya ng hospital, and everything being afforded to the patient are part of inpatient care, then those should be covered under our existing COVID-19 packages. Sabi ko nga kanina, sinabi natin, entitled sila dapat sa mga pakete na yon. So yun naman po
Pero
ang
sa
ating
ER,
nilinaw.
sa emergency po ba, covered din po, ER? Kasi
Well, may
maraming
mga
report na hindi raw covered pag
may
ER lang.
May mga
Oo.
procedures po tayo sa ER na kino-cover po natin, ano po. So ano man yung gagawin sa kanila diyan, meron tayong kaukulang case rate, no? Basta sabi nga, if it's a procedure, dapat meron siyang kaukulang relative value doon sa scale, ano po. So among many others. Ngayon, ang atin lamang po para maging malinaw po lalo yan kasi in the context of COVID-19 treatment, no, kailangan po natin na talagang maglabas ng mas maliwanag na guidelines para po may gabay yung ating mga healthcare providers. At syempre, ang atin pong pinaka-objective, sa anumang situation na haharapin, dadaanan ng patient, dapat meron po silang sapat na financial protection from PhilHealth as guaranteed by UHC.
Mr. Ray, I'll just squeeze in one more question po. Kasi I'd
Opo.
like to find some sort of resolution dun sa issue ng copay. Kasi sa huli po, the Hospital Association, kayo po ang dinadahilan. Kayo po ang dinadahilan. That's why some of them daw are turning away patients kasi they have a dilemma daw of some sort. So my question is, so what happens next? What can be done to resolve the situation? Does somebody have to be held accountable? Kung hindi tumatanggap ang mga hospital based on the idea na hindi pwedeng mag-copay, therefore hindi raw ma-afford mga hospital. I mean, in the end, what has to happen? What will happen?
Sinong mananagot?
Well, the way forward is really collaboration, ano po. And we are glad na yan ay nailapag na sa lamesa sa discussion, no, between PhilHealth and Philippine Hospital Association. And as I said, nag-commit si Attorney Giran that we will study it, ano po. At yun naman pong pagre-review ng ating COVID-19 packages, hindi naman po yan tumigil, ano po. Since late last year, dire-diretso pa rin po yung meetings na, no, with specialty societies. Kasi alam din po natin na as we progress, no, as we increase our knowledge, no, at nag-i-improve yung approaches for COVID, nagbabago din. And alam namin may impact yan when it comes to costing. So, ang amin namang garantiya po, no, mag-collaborate lang po tayo, no. Let's talk pa, let's conduct more dialogue kasi kinumit naman po yan. Kahapon kinumit siya ni Attorney Giran. So, pag-aaralan po yan, possible na mag-adjust po yung mga packages at with consultation sa mga stakeholders, then we will be able to introduce a new set of package perhaps, no po, na talagang wala nang magiging dahilan yung mga hospitals to shoo away patients. Pero alam nyo po, sa pagkakaalam ko, pagka halimbawa tumatanggi sa pasyente yung ospital, baka po may nalalabag din silang batas. So dapat po ay sana mapag-isipan din pong mabuti.
Sir, last na lang, short lang. Sir,
Opo,
is
ma'am.
it true na yung mga nako-confine for mental stress ay hindi covered ng COVID, ng PhilHealth, kahit na, well, it's really mental stress arising from, let's just say, the situation now. Kasi ang dami na ngayon talaga, sir, na, as you know, suicide cases are on the rise. And so, yun po ba, hindi po ba covered ng PhilHealth yun?
Well, ma'am, I am not particular pa, no, on such reports, no. Pero as a general rule kasi, PhilHealth provides, no, coverage for patients, no, who are hospitalized for not less than 24 hours for a condition requiring hospitalization. So yung ating general sabi nga condition, ano po. So ang sabi ko nga, kung halimbawa yung isang patient, no, suffering from stress or anxiety and other
Yes.
mental health issue, ano po.
Dami po niyan ngayon.
Opo, and if they will be confined, no, and meeting those conditions na binanggit ko, then by all means they will be covered by PhilHealth. I will get back to you, no, kasi alam ko meron din tayong dine-develop ng mga specific packages, no, in response to mental health. So at the moment, yan ang assignment ko naman po sa inyo.
Sige, yes, papalitan.
Kay yes, ma'am.
Ulitin ko lang yung reminder ninyo na ang mga hospitals may be violating laws kapag tumanggi sila sa pasyente. Tama ba yun?
Well, baka po, no? Baka may malalabag sila ng mga batas, no? Sakaling sila po itatanggi sa mga pasyente. Kung ang pasyente po magrereklamo, ay baka po, no? Meron silang ma-violate ng mga batas. I'm not particular kung ano pong batas po yun, pero baka po may nalalabag sila.
Okay.
Okay, Mr. Ray Balena, tagapagsalta po ng PhilHealth. Maraming salamat for joining us tonight. At ingat po kayo parati.
Thank you, sir.
Hindi po.
Maraming salamat din po at mabuhay po kayo.
That will be all for this Tuesday edition of The Chiefs. We hope what was discussed here will keep the conversation going. And remember, mask on, wash hands, and stay safe, Philippines. I'm Ed Lingao.
I'm Mami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
Nawala si Robbie.
He's Robbie Alampay of One
Please,
News.
Robbie, alam pa.